Hey everyone, and welcome to The Explainer. Today we are breaking down a seriously fascinating, comprehensive guide on Panchakarma, straight from the Pure Herbal Ayurved Clinic in Melbourne. We're going to be guided by the clinical insights of Dr. Gurnam Singh Saini, drawing on his over 20 years of clinical experience to figure out how this ancient system actually works in the real world.
Okay, let's dive into this. Is Panchakarma just an Ayurvedic detox? Now, your first instinct is probably to say, well, yeah, of course it is. It's incredibly common to assume that Panchakarma is just a fancy word for a juice cleanse, or maybe a series of relaxing spa massages. But the reality? Authentic Panchakarma is actually so much more than a quick, superficial cleanse. Think about the stark contrast here. On one side, we have your typical modern detox, the restrictive juice cleanses, strict fasting, maybe a weekend retreat where absolutely everyone gets the exact same green smoothie. But on the flip side, authentic Panchakarma is a highly structured, clinical system that's been developed and refined over thousands of years. It requires rigorous physical preparation, meticulously individualized treatments, and a very heavily guided recovery phase. The goal is restoring harmony to your entire physiology, not just flushing out your system for a weekend.
All right, here is our roadmap for today. 1. More than a detox. 2. The Ayurvedic view of health. 3. Stage 1, preparing the body. 4. Stage 2, principal therapies. 5. Stage 3, recovery and rejuvenation. And finally, 6. Panchakarma in modern life. Because Panchakarma is a process and not just a one-off procedure, understanding this entire journey is absolutely essential to seeing how it truly works.
Section 1. More than a detox, a process, not a procedure.
To really wrap our heads around Panchakarma, we need to completely throw out that modern detox buzzword. Just toss it. Look at this central quote. Panchakarma is a process, not a procedure. While the word itself literally translates to 5 therapeutic procedures, treating it like a standard, single procedure completely misses the mark. It's a carefully planned therapeutic journey. That means every single patient's experience is entirely unique. There is absolutely no cookie-cutter standard package here.
Let's move to and see how this builds. Section 2. The Ayurvedic view of health. Understanding the rules of the game.
Before we can even look at the treatments, we quickly need to learn the vocabulary of Ayurveda. These two terms dictate exactly why this process is so deeply individualized. The practitioner isn't just looking at a conventional disease label. Instead, they're constantly comparing your prakriti, which is your unique, natural baseline constitution, to your vikriti, which is your current state of imbalance. It's actually the gap between those two states that guides every single clinical decision. And those imbalances, they're understood through the 3 doshas: vata, pitta, and kapha. Now, these aren't physical organs. They are functional biological principles governing movement, metabolism, and structure. Think of your own body right now. Everyone has all 3 of these functioning at all times. Illness simply occurs when one or more of these doshas become disturbed or aggravated.
So the crucial point is that before any purifying therapies can even be considered, a practitioner must evaluate your Agni. Assessing your Agni, or digestive and metabolic fire, is actually the very first step. Why? Because weak digestion directly leads to the creation of Ama. Ama is incompletely processed metabolic residue. Think of it as a biological sludge that literally blocks normal physiological function. You simply cannot heal the body if your digestive fire isn't strong enough to process what's going into it. Section 3, Stage 1, preparing the body, Purvakarma. This brings us to the very first chronological phase of the patient's journey. And let me emphasize this, starting treatments without this step is a massive, massive mistake. Panchakarma consists of 3 strict, interconnected, and sequential stages. You just cannot skip straight to step 2. Attempting those principal purification therapies without first undergoing Purvakarma, the preparation phase, is literally like trying to clean a messy house without first gathering all the scattered clutter into one place. It just doesn't work. Purvakarma itself breaks down into 4 parts. First, Dipana and Pachana support your digestion and process that sticky metabolic residue we talked about. Then, Snayana and Swedana use therapeutic oils and sweating to loosen the aggravated doshas and mobilize them back toward the digestive tract. To borrow a brilliant analogy from the source material, these 4 steps are exactly like preparing, tilling, and nourishing the soil before you plant a garden. You are prepping the internal environment so that the deeper therapies are actually effective and, most importantly, safe. Section 4, Stage 2, Principal Therapies, Pradona Karma. And this brilliantly illustrates the main event.
But contrary to popular belief, almost no one actually receives all 5 of these therapies. Looking at the specific focus for each therapy shows us why. Vamana targets kapha imbalances, Virachina is for pitta, Basti for vata, and Nasya for the head and neck. A skilled practitioner carefully selects the lowest appropriate therapeutic intervention based on which specific dosha or area is aggravated. It is highly targeted, not a scattergun approach. This insight from Dr. Saini really hammers the idea home. Treat the individual, not just the condition. You could literally have 2 clients walk into the clinic with the exact same conventional medical diagnosis, yet they might receive completely different therapies in this stage. Why? Because their natural constitution, their current digestive strength, and their unique doshic imbalances are entirely different.
Section 5, Stage 3, Recovery and Rejuvenation, Panchakarma.
Now, once those targeted therapies are complete, a quick warning. Jumping straight back into your normal, busy routine right now would absolutely ruin the entire process you just went through. We enter Panchakarma, the recovery phase. It is vital to understand that in Ayurveda, purification is not the final goal. The real goal is rejuvenation. It's about rebuilding the tissues, restoring your digestive capacity, and preparing the body for long-term resilience. A huge part of this rebuilding is samsarjana krama, which is a meticulously planned, gradual reintroduction of food. Because your digestive system has just been through a major therapeutic intervention, it is incredibly sensitive. You don't just go out and crush a heavy steak dinner. Your diet is stepped up slowly, starting with very light mung bean dishes, thin rice scrolls, maybe warm vegetable soups, and gradually moving to more complex foods. This ensures your sensitive digestive system is supported and never overloaded. Section 6, Panchakarma in Modern Life, Bringing Ancient Wisdom to Melbourne.
Now, what's really interesting about this side is that it perfectly captures why this is so tough for us today. You might be wondering how a modern professional could possibly take weeks off work for this. We're dealing with long working hours, shift work, massive occupational stress, endless screens, and way too much coffee. These uniquely modern Australian problems are exactly why local clinics assess your sleep, your emotional well-being, and your daily occupational demands before prescribing anything. That's exactly why practitioners offer modified Panchakarma. It adopts these classical principles to fit around your work and family life without compromising safety. Undertaking this at a local clinic allows for staggered treatments, and most importantly, continuity of care. You actually get to rest and recover in your own familiar surroundings, in your own bed, rather than taking a stressful, exhausting long-haul flight immediately after deeply sensitive therapeutic treatment.
We'll leave you with this provocative thought to reflect on. Based on everything we've covered, what do you think the current state of your Agni, your digestive fire, really is? And how might your fast-paced, modern lifestyle be masking your true, natural constitution? Understanding your own unique balance is the very first step on this incredible journey. Thank you so much for joining us for this explainer. We really hope it sparked your curiosity to discover your own unique balance.